Welcome back. Time for our nightly COVID-19 question and answer session. We call it Ask the Doctor, and we are joined once again by Dr. Jonathan Dario. He's a family physician affiliated with Adventist Health Bakersfield. Good evening to you, Doctor. How are you tonight?
Good evening, Jay. I'm doing well. How about you?
I'm doing well, thank you, all things considered. Let's start with this. Kern Public Health reporting 2 more deaths and 60 new cases of COVID-19 this morning. Do you think this is a reflection of increases in testing capacity, in your opinion?
Definitely we've had more available capacity of testing, so we can see more positive cases. I think the thing we have to look at too is how many are really affected, as in they need to be hospitalized, or for the patients, how much it's using our healthcare system, as well as you might be having 60 cases, but it's also a reflection of how well we were doing about 2 weeks ago regarding our social distancing, because it could also reflect if we were a bit lax during that time. So just encourages us to continue right now following the restrictions that are being given, and then just make sure to stay safe and continue wearing masks, wash your hands frequently, and keep 6 feet away from people. So.
All right, nursing homes, they have been real hot spots for COVID-19. Some 7 deaths reported nationwide now associated with those facilities, and more than 35,000 cases of COVID-19. This is according to an analysis by the New York Times. And now we, of course, have Kingston Healthcare here in Bakersfield reporting an increase in cases there. 70 total cases now in that one facility. Why are nursing homes such hot spots for COVID-19?
Well, in general, in any infection, nursing homes are a kind of a vulnerable spot to having more resistant, more rare organisms, because these are people who were sick enough that they couldn't go home. Maybe they were originally at the hospital. And the problems with nursing homes, it's the close quarters facility, so it can easily spread. I know, especially when this all started, a lot of nursing homes were trying to prepare themselves and do the best they can to protect their residents from getting the spread of that coronavirus. So it's definitely a challenge, definitely work that they're working on currently.
And Dr. Dario, the LA Times is reporting about a new strain of coronavirus, something, of course, none of us wants to hear right now, one that scientists say appears to be more contagious than COVID-19 and has also become dominant worldwide. Let me ask you, first of all, have you heard about this new strain? And if so, what do you know about it? And can you ease the minds at all of people that are hearing about this?
I haven't heard much about the new strain of the coronavirus, but even if we're having a new strain, at least now we've kind of gone through our first round of preparing ourselves, seeing if it really is one that is very infectious, or even much more has a higher morbidity or mortality on patients. We've kind of prepared ourselves to have the tools necessary to combat another infection, and we know how to kind of prepare ourselves in the future if that's something that's starting to spread again.
Okay, well, more questions.
I think we have time for one more question.
Okay, go ahead, Tammy.
Okay, we have a viewer question from Michelle, and she wants to know, Doctor, is there a temperature at which the COVID-19 virus is killed? Do we know, for instance, when it gets over 80 degrees, or has there been any concrete research on that?
More of it is just hearsay, that you say that like viruses or certain illnesses like the cold don't do well in warmer weather, which would be another viral illness. We do see that a lot of viruses in the summer months, maybe it's partly that your immune system does better. The heat does have some effect on sanitizing surfaces on the outside. But there's no proof that it itself, the overall temperature, will kill the coronavirus itself. For sanitation purposes, you have to have very high temperatures to kill bacteria viruses, but it does, the warmth can have some protective effects, but there's no study, there's no proof, unfortunately.
All right, well, that doesn't, we were hoping maybe for a little help from our hot, dry climate here in the southern San Joaquin Valley, but that appears not to be the case. Dr. Jonathan Dario with Adventist Health, thanks for your time tonight, sir.
Thank you. Have a good night.
Okay.